Hi everyone, my name is Janelle. This is my first YouTube video, so I'm trying something new. I've always wanted to do this, but here we are. I'm a nursing student. I just finished my third semester out of 5. Woo! Almost done. And I just thought it'd be interesting to see what's in my clinical bag. So let's just jump right in the video. So this is my clinical bag. It's pretty big. It holds a lot of things. I got this on Amazon, I think. So yeah. All right, since this is right here, we're just gonna start with this. This is basic. A water bottle. Any water bottle of your choice, because usually, well, with my school, our clinicals are anywhere from 8 to 12 hours. Most of them are 12, depending on your clinical instructor, if they let you leave early, but you're gonna need to stay hydrated. So water bottle, that there. Okay, let's see what else is in here. Okay, so I have a regular watch that I bring to clinical, especially like med surge or like a non-specialty clinical, because I like to see the second hand. Some hospitals have like this clock, but some of them just have the time written, and whenever I'm counting respirations, I like to use my watch. So I just have a regular watch here. Okay. This is just my student badge. I'm gonna cover my school name, but yeah, this is my badge. And I also have my ID. Depending on the clinical site, you might have to get a badge from them specifically, but that's just my school ID. Okay, so I don't eat breakfast very early. So I usually have like a snack, like a granola bar on me, just in case, something to hold me up until I'm actually ready to eat breakfast, because most clinicals start like 6:30, around that time. So let's get in here. All right, so I'm just gonna pull out whatever's on top. This is my charging case. So I just have my computer charger here and like a phone charger or iPad charger, whichever one. I don't use my phone or computer or iPad that much for it to be dead at clinicals, but I just have it just in case, because you never know, maybe I forgot to charge it the night before or something like that. My Beats, this is basically when I have downtime. Depending on your clinical instructor, depending on your professor or your clinical site, you might have a lot of downtime or you might not have any at all. So I just bring this just in case I get a chance to study, and I can put these on and just like block out the environment that I'm in, because usually it's either the break room or a conference room that the students are in. So I just have these. Okay. And I'm sure everybody's seen this famous foldable clipboard from Amazon. I have that as well. I can't say how much I really use it, but I just have it just in case. And it has, you know, the lab values and all the information on it. My trusty Clorox wipes. Okay, y'all, call me a germ freak if you want to, but I stay with these wipes in my clinical bag and my regular school bag, because people out here are nasty. 1, 2, my school, no shade to my school, but the library, they do not keep it as clean as they should. So I always walk with my wipes just to wipe down the counter before I put my stuff down, and that's just me. You don't have to do that, but like especially when I can visibly see like hair or crumbs, like I don't like that at all. So I got my Clorox wipes. Can't go to clinical without your little stethoscope. I got my stethoscope case here, which has my Littmann stethoscope. It also has my pen light and my bandage scissors. I never used to bring these with me to clinical, but ever since med-surg, when a lot of the patients get the lidocaine patches, you need scissors to open those. So I just bring it with me every time now. All right. This is basically like a hygiene type of kit, self-care, whatever you want to call it. So in here I have, all right, so I have a little spray in here because you know you might need it. You might have forgotten to put it on from earlier. I have a small little travel size deodorant, just if either I forgot or you know you need it throughout the day. I have some bandages just in case, you never know. A scrunchie for me or for my friend if they need it. I have hand sanitizer. Like I said, I might be a germ freak, but that's just me. I have my lotion. I have my chapstick here. And I also have some Tylenol. Sometimes I get headaches depending on like if I'm staring at the computer too much, or sometimes they can just be random. And one thing with my headaches, I cannot like focus. I can't do anything really. So I just bring this just in case I get one at clinical, because you know you're still expected to remain professional. You're still expected to do the work that you're supposed to do. So I bring that just to help me to get through it if I do need it. Another scrunchie, and then I just have like panty liner and tampon just in case I was to come on my cycle at clinical. I have my laptop, but I'll do that last. My planner. I like to have, you know, my assignment due dates or just anything in here, like anything that I need to do, to-do list I can check this and just check it off while I'm there. And then my laptop, like pretty self-explanatory. I never used to bring my laptop to clinical. Well, my first semester I never brought it, but after that I bring it every time just because I don't know if I'm gonna have downtime or not. And if I do have downtime, that is the best time to get my assignments out the way. Like, perfect, because I already have to be at clinical. It's an obligation. Why not get some schoolwork done in the meantime and kill two birds with one stone? Okay. And this is just like writing utensils, basically. I have a marker because, you know, I used to be a CNA, and if you know, you know, the whiteboards don't be whiteboarding. So I just have my my marker just in case. And I think this is the last thing. I have these little notepads. Basically, I have one for each clinical. I take down notes from either my clinical instructor or my nurse that I'm paired with, or anyone that, you know, is giving me tips and tricks or an advice or anything. I have this with me so I can write stuff down. And y'all, oh, just another chopstick. But I think that is it for this video. I would also usually have my umbrella I mean, if I know it's gonna rain, I'll bring it definitely because it can fit in the other pocket in my bag. But that's pretty much it. I hope you guys enjoyed this video. Thank you for watching. See you next time.